Welcome to the module Assessing Healthcare Transition Readiness. This is the 6th of 10 presentations in the course. By the end of this module, you will be able to discuss the importance of healthcare transition readiness assessment, administer assessment tools, and integrate healthcare transition assessment worksheets into IHP 504 and IEP evaluations. Assessing healthcare transition readiness incorporates concepts discussed in the previous 5 modules, including the healthcare transition stages and the areas of transition. Assessing healthcare transition readiness lays the foundation for skill development. A young person's knowledge about their disability is paramount to independently managing their condition. Also important is knowledge of good health habits such as diet, exercise, and sexual health. Finally, students must learn to identify important changes in their health and determine how to respond when they are in crisis.
Experience going away to college, it was very exciting, yet very nerve-wracking at the same time. I think you have to understand that the only time I had really been away from my family before that for any length of time was at a summer camp, and for not even a week. So going away to college was such a big transition for me.
Yet there was still the concern that Jeff was being cared for the way that he was cared for at home. It was easy to do it. Jeff made it very easy to do it with the smile that he had on his face when we drove away from Keene State College. When we called the next day and he was too busy to talk to us, we knew that it was the right thing to do. And seeing him and seeing how happy he is and seeing the things that he's accomplished at school, you knew that it was time to let go.
I've wanted to come here since I was a sophomore in high school. I think the campus is very handicap accessible, which obviously for me was one of the primary factors in considering any college. A little story behind that, my mother was involved in a parent support group when I was in high school. And for one of their meetings, they had several disabled student coordinators come and speak from various colleges. And the coordinator from this college, Jane Warner, came to speak, and I really was impressed with what she had to say.
Students with more medical and physical disabilities, the important piece is to really work with the student up front in regards to what those might look like. I know when we were working with Jeff, he came prepared with lists of questions that he had and was really upfront with us in terms of what he might need for assistance early on and how would we problem solve around that, from the note-taking, eating, and some of his personal care issues. There was a lot of consideration around that.
A big part of that preparation came from the Independent Living Center. Their social worker there provided various training for Jeff and us too.
Jeff requires total care for everything that he does, feeding, dressing, bathing, having his clothes put on. I mean, there's basically very little that Jeff can do because he has such limited use of his upper extremities.
That is definitely frustrating at times, but on the other hand, I've come to terms with that, and I realize that that may never change, and that's just something I have to live with. I mean, I'm not going to let it stop me from achieving my ultimate goals.
So now he gets care at school, but it was learning how to manage that care. And again, it was supporting Jeff through the earlier years, and then again throughout the summer before college began, of planning out what the attendants needed to do, of working through the Independent Living Center and being trained on how to hire personal care attendants, how to fire personal care attendants, how to handle conflict, and how to best do all of these things.
I think you're getting better at it.
I think so. I'm not as afraid anymore of breaking your arms.
Ryan just does it, she doesn't care anymore. In terms of my personal care, while it's pretty easily managed now, it wasn't always that way. Let's see, if you could put the C book in my, not the one that's out, the other one.
Yeah,
The one that's out is mine.
This section introduces student assessment tools. The Healthcare Transition Readiness Assessment Questionnaire, or the TRAC, and the Healthcare Transition Planning Guide worksheets are the recommended assessment tools. They both have separate sections for students and for caregivers. The track and the planning guides integrate with and support special education evaluation tools. Track is a validated, student-centered questionnaire to assess youth's healthcare self-management knowledge and skills. It is self-administered and takes less than 5 minutes for youth to complete. Track is available in an Excel file to input, score, and aggregate results, or in PDF. Take a moment to review the response options on the track. These provide a range of ability levels, from no knowledge to complete skill mastery. The track consists of 20 questions that assess the student's skills within 5 categories. It is important to emphasize with the student that the document as a whole is meant for ages 12 to 21. Some activities will be age appropriate for the student and others will not. Including the track with annual IHP 504 and IEP planning for families is an easy way to introduce healthcare transition assessment. In keeping with the gradual release of responsibility framework, the student is the track's target audience. Emphasize that there is no right or wrong answer. The assessment simply takes a picture of the student's current habits. The 3 planning guides are age-specific, separated by the 3 healthcare transition stages. They include assessment worksheets for students and for parents to complete at home. The worksheets present an opportunity for students and their families to engage in dialogue about healthcare transition and to think more comprehensively about needs and future plans. Thinking about the future asks a series of yes and no questions and has checkboxes. Questions are grouped under the headings of school and work, living arrangements, and planning. Pages 23 through 27 of the guide provide worksheets on healthcare independence using the 8 areas of healthcare transition. Envisioning a future is a critical first step in the long-term process of healthcare transition. The first planning guide asks a number of questions to start this process. Planning Guide 2 follows a similar format to the first guide, with added emphasis on the youth's new responsibilities and their self-efficacy. The first 2 planning guides for youth have only 2 sets of student worksheets, Thinking About Your Future and Healthcare Independence. Parents complete the other 2 sets of worksheets. In the final guide, the Healthcare Transition Plan worksheet is part of the students' rather than the parents' activities. This reinforces the idea that young adults now have the lead role in directing their care. Assessing healthcare transition readiness complements the present levels of academic achievement and functional performance assessment. It is especially relevant to the domains of communication, independent functioning, and social-emotional behavior. Healthcare Transition Readiness Assessment correlates to the 504 evaluations, especially the sections on major life activities, help information, manifestation determination, and mitigating measures. The next few slides discuss using track and the planning guides with parents or caregivers. Parents and caregivers' input is important during assessment. The track provides them with a separate set of directions. Emphasize that the parent should not complete the student's form for him or her. Ask parents to fill out a separate form using their instruction set, then compare to the student's responses. The first 2 planning guides have 3 sets of parent worksheets. Thinking About Your Child's Future, Parents' Healthcare Transition Activities, and the Transition Plan Family Worksheet. The questions in the worksheet for parents correspond to those in the worksheet for youth. For example, My child will finish high school on page 5 matches I plan to finish high school on page 19 of the youth worksheets. This section appears in all 3 guides. It assesses the caregiver's transition preparation activities with the student. Children with significant physical limitations will not have a goal to complete independently. Their ability to direct others, for example, a personal attendant, is the more appropriate goal. Therefore, both options are presented in the caregiver worksheets for the age of responsibility. Even at the age of transition, the planning guide provides questions for the parent to answer about themselves. The questions address key activities that support their child's independence, including those for early transition related to insurance, SSI, and vocational rehabilitation services. The next few slides discuss how to introduce and administer assessment tools with your students. Recall the 8 steps of the transition process. The first 2 steps describe assessment concepts. They are key to all subsequent transition activities. When introducing the assessment tools to students, build off of your initial healthcare transition conversation. Each student should start with assessment tools for Stage 1, regardless of their age. Including healthcare transition readiness assessment in your scaffolding conversations will help make it a natural part of your regular activities. Recall that, especially in the area of decision-making, it may be appropriate for individual students to begin transition preparation before age 14. The Florida Algorithm for Youth with Special Healthcare Needs highlights healthcare transition readiness assessment beginning at age 12. Middle school teachers might use healthcare transition concepts as part of activities for the transition to high school. The Florida HATS Toolkit includes the track as a PDF with a separate scoring guide. Earlier slides provided examples of that format. The toolkit also offers an alternate format of the track as an Excel file to input, score, and aggregate results, seen here. Students' and parents' responses to the healthcare transition assessment tools will lead to better preparation for IHP 504 and IEP meetings. Use their responses to create the transition services plan or to evaluate progress on the previous year's goals. The planning guides are lengthy. To avoid overwhelming the student or the parent, advise them to break the worksheets into smaller portions. Students and parents should complete their worksheets independently outside of IHP 504 and IEP meetings. These worksheets support the in-person track assessment. Module 7 will discuss how to use the Healthcare Transition Plan worksheets. The guides are organized developmentally, with all students start at the first Healthcare Transition Guide, building with the student's abilities year by year. If a child is unable to use the planning guide, support parents' worksheet completion. Include the student in this process to their fullest capability. There are multiple ways to integrate healthcare transition assessment with IHP 504 and IEP evaluations. Joe is a 19-year-old man with a severe seizure disorder and mild intellectual disabilities. His health depends on remembering to take his medications, on getting enough sleep, and abstaining from alcohol. Joe lives at home with his mother. She provides daily reminders for medications and sets up his pillbox every week. She also reminds him about sleep every evening and about alcohol anytime he leaves the house with his friends. Joe will graduate from high school in June. His IEP transition goals are to become a chef and to move into his own apartment. Over the last year, he has completed community college courses on food preparation. At the end of the semester, he hopes to become a sous chef through a work-study program. His mother found an apartment for him that is near a community service provider and has agreed to fill out Joe's lease application. However, as graduation approaches, Joe's mother is increasingly concerned that he is not prepared to manage his seizure disorder without her supervision. She has concerns that his health will suffer and there could be long-term consequences of ignoring the doctor's advice. Joe and his mother now frequently argue about whether she should delay the apartment application for a year or two. Using the track, Joe's transition coordinator realizes that he answers many of the questions with, "No, but I would like to learn." Based on their work for independent living and employment goals, the transition coordinator believes that Joe is capable of completing many healthcare transition activities himself. Most of his mother's concerns could be addressed, with modeling and practice, by transferring responsibility for healthcare activities from Mom to Joe. The transition coordinator wants to discuss this with someone at his doctor's office when she sends the IEP evaluation form. Jane is a 16-year-old student with type 1 diabetes. Her health depends on maintaining a stable blood glucose level. She has had an insulin pump since age 13. Jane lives with her parents and younger sister. At school, she participates in marching band and takes AP classes to prepare for college. Her marching band instructor is certified as a trained diabetes personnel, and her 504 plan includes notifying teachers of Jane's diabetes medical management plan. Jane's mother has been in charge of the insulin pump for the last 3 years. Her mom also provides reminders about nutrition and physical activity, accompanies the marching band to away games, and makes all of the pharmacy runs for supplies and medications. Jane is preparing to take the SATs this year and hopes to go to college in California. Her parents are afraid that Jane is not prepared to take care of her diabetes and that she will wind up in the emergency room. They think California is too far away for someone with type 1 diabetes. Jane's resource specialist realizes that fears about diabetes could jeopardize Jane's goals. The specialist provides Jane's family with a planning guide as part of her junior year 504 reevaluation. When the family completes the guides, they realize that Jane doesn't know what is in her diabetes medical management plan or how to adjust her insulin pump after exercise. What would be the best year to begin healthcare transition assessment with Joe and his mother? How about with Jane and her parents? Jot down your answers to these questions. The slide will automatically advance in 1 minute. Before closing this module, we will examine additional resources. Medical evaluations and other documents in IHP, IEP, and 504 planning are a natural way to include providers in healthcare transition assessment. In 2014, the National Center for Healthcare Transition Improvement released a new transition readiness assessment tool similar to the track that matches each domain of their 6 core elements. The Wiseman Center offers additional resources for integrating health and IEPs. The Florida Department of Education offers example IEPs and implementation guides for 504 planning. Healthcare transition assessment integrates with and supports existing special education evaluations. Use these tools to your benefit when preparing for the student's transition plan. Use the links from this course's toolkit to access the tools from this module. The next module demonstrates how to use assessment results to address students' gaps in knowledge or skills. You can pause here for a break or continue to the next module.